Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the country continues to break records in new COVID-19 cases, with experts saying we have yet to reach the peak in this COVID-19 surge. Also, hospitals remain full with a stream of COVID-19 patients, and Metro Manila still waiting for the final guidelines and the public of the proposed alert level status. OCTA Research Fellow Guido David and Interior Undersecretary Epimako Densing join us live. We begin with breaking news here on CNN Philippines. The Health Department detects 640 additional cases of the Delta variant in the country, bringing the overall tally of detected Delta variant cases to 2,708. The 640 new cases, are from 748 samples tested by the Philippine Genome Center. The DOH says 584 are local cases, while 52 are from returning Filipinos. 4 are still being verified. The World Health Organization says that the Delta variant is the dominant COVID-19 variant in the country, and there are clear indicators of a nationwide Delta community transmission. Community transmission happens when clusters of COVID-19 cases could no longer be linked to each other. In other news, a few days before the target pilot testing of the so-called alert level scheme in Metro Manila, local leaders are still awaiting the final guidelines. Some mayors are appealing for these rules to be cascaded soon so they could discuss with stakeholders and map out implementation before the actual rollout. Meantime, amid the easing of restrictions, COVID-19 cases are steadily rising. The country records 26,303 new cases on Saturday, the highest so far since the start of the COVID-19 pandemic. So let's go straight to the source of the story. We have OCTA Research Fellow Professor Guido David. Professor, welcome to The Source, and of course, thank you for your time.
Yes, thank you, Pinky, and good morning.
So we reached an all-time high of over 26,000 cases. That was last Saturday, and yesterday it was over 21,000 cases. Have we reached the peak of COVID cases here in the Philippines, or are you projecting a higher number?
Unfortunately, Pinky, we have to be honest with the data. We don't think we have reached the peak yet, and that would be, frustrating. Of course, we reached an all-time high in cases of about 26,000, and it was not just an all-time high in the Philippines; it was also an all-time high in the National Capital Region, where we had 9,000 new cases on Saturday, and it was also an all-time high in several LGUs in Metro Manila. So, of course, this is concerning because, the reproduction number is still greater than 1 in the country. It's still about 1.3. So it means that cases are still increasing on average. And although we admit that, or the Department of Health disclaimed that not all of the 26,000 cases were due on Saturday, some were attributed to Friday, I think 1,600. But that would still be almost 25,000. And that was, what we projected several weeks ago, that we would exceed 25,000 cases, yes.
Yeah, I remember you said that by mid-September.
Right.
Let's try to break down the numbers, because this is where I'm a little confused. Two things, the R naught. Every time from our last conversation and from other interviews I've heard from you, please correct me if I'm wrong, the R naught has actually been going down. So that's the reproduction rate. That's about 1.3 something, maybe 1.34. Why are the cases still going up if the reproduction number is actually going down?
Right, Pinky. And the reproduction number is going down, and it's also in line with the growth rate, which has, it has gone down. But recently, over the past 2 or so weeks, the growth rate has actually been flat. And I think the reproduction number has been more or less flat. It has gone down a little, gone up a little. It has more or less stayed within the zone of, in the NCR
1.34.
within 1. It's about between 1.4 and 1.45 right now in the National Capital Region, and the growth rate of about 15%. So because the growth rate is still positive and it has stayed there, then it means cases will continue to accumulate. Every week we will add another 15%. So that's the problem. So cases will still continue to increase until we can reduce the reproduction number to less than 1, or the growth rate to less than 0%, or we want to have negative growth rate for cases to start decreasing.
Pero yung sinasabi niyo, Professor, na growth rate of 15%, from my understanding, that is a growth rate of 15% in the numbers that we're seeing on a weekly basis. In other words, if we're seeing 20,000 average a week and a growth rate of 15%, sa susunod na linggo, dadagdag po yan ng 3,000 because 15% of 20,000, I believe, is 3,000.
Yes, that's correct, Pinky. Yeah. And I know you know your math, so yeah, you got it.
Sometimes I do, sir. So what numbers are you seeing by the end of September?
Well, we have different scenarios, Pinky. So if we continue with this kind of growth rate of 15% every week, right now we're averaging about 20,000 or a little close to 21,000. And as you said, if we add another 3,000, by next week, we'll be averaging maybe 23 to 24,000. And if we add another 3,000 or 4,000, we will be getting close to 30,000. And because of the daily fluctuations, because sometimes there are more in one day and sometimes there are less because of the backlogs, we might reach 30,000 cases before the end of September. There's a possibility. We could also miss that, but that is assuming the growth rate does not change. Now, of course, what we want to do is we want to help reduce the growth rate to a negative number so that we will reach the peak and cases will start decreasing before the end of September.
What indicators or what are you hoping to see? What will help the growth rate actually go down?
Well, we have to admit it. We have to face the fact that the current status quo is not helping decrease the growth rate, because the growth rate has been fairly stagnant for the last 2 or so weeks. We were hoping that it would go down, because last April, when we got down to 10 to 15% growth rate, just a week or 2 later, we were already at negative growth rate, but this hasn't happened. So, of course, we have to scale up some of our interventions, add more testing, maybe more randomized testing. And I'm aware, of course, that they're going to implement a new strategy. My understanding is this is based on the strategy used in Cebu City, where they're now on a downward trend. So they were able to successfully manage the pandemic in Cebu City. So this kind of strategy, I have yet to see the guidelines, but we have to hope that this will work to help bring down the cases.
In fact, I'll speak to Undersecretary Densing about that. A lot of people are really wondering what these alert levels will be from alert level 1 to 5. But there are other issues I wanted to discuss with you. What happened, Professor, to our vaccination? Has it proven effective? I ask that because last Saturday in NCR, because a lot of the vaccination, of course, has been focused on NCR, the numbers were 9,000 cases in NCR alone. And then Sunday, which was yesterday, the cases dropped to 5,000. But still, that's still a very high number for NCR, considering that a big percentage of the population has actually been vaccinated.
Well, yes, and let me explain that drop-off first, Pinky, because as I mentioned, sometimes backlogs are accumulated. And the reason for that is some major testing centers and laboratories report late. Now, sometimes they report 1 to 2 days late, but there are times when some laboratories report up to 1 week late. So sometimes you have a backlog of 1 week of cases, and then you add all that, and then that's going to produce an artificial spike We're not saying
Right.
that, that's not a true number, but if we even it out over the week, we're still averaging 6,000 cases per day. So we can think of it as,
Mhm.
every day we're just getting 6,000 cases. So that's still a lot because that's already higher than the 7-day average we had last April. So by all intents and purposes, we have exceeded the April surge. And that's concerning because, and like you said, why is that when we have so many vaccinations already in the NCR? And that is a very, that's a very important question that we have to, look into. My understanding is that the vaccination rate is at least 30% fully vaccinated in the NCR of 30% of the entire population. And, we have to analyze the data. How many of the cases are vaccinated, fully vaccinated, partially vaccinated? To date, we have only seen some data, and we're trying to study this. I mean, will this have an effect on the hospitalizations? Because based on preliminary data that we're looking at, there may be more cases, but there will be less ICU cases and hospitalizations. Although I can't say that we have seen that yet, because hospitals are still full at this time. But maybe the rate of hospitalization has decreased. So this is something that we have to unpack from the data once we get that.
It's good to look into that, Professor, because if we look at the DOH data and look at the severe and critical, which now averages about 2%, could be severe at 0.6 or critical 1.3 or vice versa, that totals about 2%. It's good to find out what was the severe and critical back in April. Was it still also at 2%? Because that tells us, I guess, one way or another, the effect of the vaccine. Because as we all know, experts already are telling us it's not foolproof. It's really to prevent severe and critical. It's a good comparison to find out. Ano yung severe and critical noong April? Ano yung severe and critical now, especially that a lot have been vaccinated. Just very quickly, one last point on the Delta. Breaking news, of course, that over 600 Delta cases were detected by the Philippine Genome Center out of 748, 750, which is the weekly average. That's about 85%. Ibig sabihin po nito, Professor, karamihan, 3/4 or even, close to, maybe 3/4 or even higher than that, is already Delta. So karamihan sa nadedetect ngayon ng Philippine Genome Center at only 750 cases a week is already Delta. With that kind of number, is going to drive the cases even further than your estimate of 15% growth and possibly 30,000 by September.
Well, Pinky, definitely we have more Delta cases now. As you said, these based on sampling, that's 85%. I wasn't actually surprised to hear that number because the last time I checked, it was about 70%. And what we see all over the world, the rate of increase of the Delta variant is very fast. And generally, it takes over the cases. It outcompetes the Alpha and the Beta and the other variants. So that soon, even in the UK, at some point, they were 99% Delta variant. So
I see.
Yes, it's not going to change the projections that much because these have, in effect, been factored in. Yes, it could increase the growth rate a little bit. We don't foresee that the growth rate will increase beyond 20%, even with the status quo. So, but of course, what we want is to reduce the number of cases.
Okay. I hope to speak to you again, Professor. Let's talk about the severe and critical last April compared to the numbers of the severe and critical in terms of percentage this time during the third, you call it peak or surge of what is happening right now. Professor Guido David of OCTA, thank you so much for your time.
Thank you, Pinky. Good morning.
And we'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned.